just want to follow up on that point. You see, you said earlier on in answer to this question that, oh, well, it's education, it's not work, so we shouldn't pay them. Now, let's be clear. First of all, that's departing from what you were forced to do in March and April when you had to acknowledge they were actually working and pay them at the healthcare assistant level. But the idea that the ones who are on placement at the moment are not working when there are 500 to 600 healthcare workers who were out with long tail COVID for more than 14 weeks, of which the biggest cohort are nurses and midwives, when nurses and HCAs are the biggest cohort of workers being hit with COVID infection in a highly dangerous, if you like, from an infection point of view, working environment, they are working. They're working, right? And they're being exploited. And in fact, our hospitals wouldn't be working without them. So the idea that they're on some sort of educational placement, yes, it's education, but they are working, they're being exploited because they're not being paid. They need to be paid as they were earlier this year.
Can I just pick up on the wider point, which is you're absolutely right, Deputy Boyd Barrett. The nurses, the midwives, the HCAs working right across the system are doing extraordinary work. We talk quite rightly about the amazing work the teachers have done to make the schools good and safe places for children to be. There isn't enough talk, and there needs to be more talk, and let's say it now, of the exact same, the equivalent work that the nurses, that the midwives are doing in the hospitals to make the hospitals safe places for our patients. And you're right, there have been a lot of cases, COVID cases, for healthcare professionals right across the board, and I agree. That nurses are the biggest group of that, absolutely, and that needs to be recognised, it needs to be said. Where I have a different view is that when we're taking first, second and third year student nurses and they're going on placements, they are educational placements, they're part of their degree. And it was part of moving the nursing profession to a professional degree. It's a critical part of their education.
Minister, on the 20th of October, I raised this issue with the Taoiseach, and it might be of interest to you to know that the video of that engagement was watched 250,000 times, which is very rare for any video I'm involved in this place, I can tell you. But that was the scale of the response from student nurses. And in that engagement, the Taoiseach said the following: with regards to the student nurses, I will engage with the HSE, the Department of Health, about student nurses working on the wards should be paid in accordance with the agreement at the beginning of this year. I will follow it up. Right? So when we put the points to him, he agreed. They should be paid for the reasons Deputy Kenny has just said. They can't get other jobs. They are working because they are replacing the hundreds and hundreds of nurses who are down with COVID. That's why they're working. Now, you can call it education placement, and it is in a certain sense education, but they're working simultaneously. They can't do other jobs. They need to be paid, not exploited.
Thank you, Lascian Corla. Look, can I say I hear you, and I recognise, and we all recognise, the work, first of all, of our qualified nursing and midwifery professions right across the country, in community healthcare and in the hospital system as well. Do the student nurses make a valuable contribution on their educational payments? You're damn right they do. Do they work hard? They work damn hard. Absolutely they do. They're the only clinical group that are funded for their educational payment. Are we looking at increasing that in a time of COVID? Absolutely I am. And we're engaged in doing that. I have a genuine concern, colleagues, that if we replicated what happened in the first wave, that it could come at risk to the educational element of these placements. And these placements for first, second and third year nursing students, first and foremost, are part of their degree. So can we and must we do more? Absolutely. And at the same time, we must protect their education as well. So what I'm looking at doing and what we're engaging with doing is the two of those things at the same time.
Thank you, Minister. Thank you.